I'm LaShawn Ford, State Representative of the 8th District, and for decades, HIV and AIDS was probably the #1 killer in and around the state of Illinois and in our country. Today, we now see major overdose deaths from heroin opioids. And so today what we have done is we put together a task force, a Westside Heroin and Opioid Taskforce to combat fatal overdose of heroin deaths. And we have combined efforts with many organizations from the west side of Chicago, including state agencies, city, county, and federal agencies to combat the deaths that are taking place from fatal overdoses on the west side of Chicago. Chicago's west side is 3 times higher than the city's average of fatal overdoses and 7 times higher than the state, and 15 times higher than Lincoln Park. So we have a serious problem on the west side of Chicago. So I want to thank Prevention Partnerships for leading the way and making sure that we bring all stakeholders together to combat the fatal overdoses that are happening on the west side of Chicago. I want to thank Task for also hosting a meeting right here. This task force has been in existence since 2016, but we are now on the move with the leadership of Prevention Partnership.
Yes, good afternoon. I'm Lou Sias. I'm Director of Outreach for the Westside Heroin Opioid Task Force. I've been a resident of the West Side and especially the Austin area since 1970s. And recently, by participating with the task force, I've had a new awakening. I've been doing communication campaigns and projects throughout the community. I've been doing outreach for about 30 years. But after being involved with the task force, I've had a new awakening of what's existing in our community. I thought I knew, but after working with the outreach team, and I have 4 members of that team that I work with on a weekly basis, they take me to the various hot spots. They are people with lived experience with opioids and heroin. So they know the language, they know the population. I've been able to now see a new community that I drove by, walked by, and didn't really understand or see that part of the community that had the health issues. Years ago, as you know, they used as a problem and they incarcerated a number of the blacks and brown people in our community. Now it's considered a health issue. And we know because it had hit a lot of the suburban areas. Now there are some more resources being put behind the opioid and heroin overdose epidemic because of the spread and because it's now affecting population other than the blacks and brown in the inner city. But I'd love to have some of my outreach workers here so they could give you some quick stories of what's being told to them out there as they work these areas, what they do with our outreach program. They go out and actually do many training sessions on the spot with the population that need the kits to reverse the drug overdose. They train them, they train their friends, and hopefully we can get around to going on the blocks training family members, because it doesn't do an individual any good to have a kit to reverse the overdose, because if he or she is overdosing, they can't use it on themselves. So therefore, we encourage people, do not, if you're involved, do not take drugs alone, because that's why we find so many of the overdose deaths where people were in basements, washrooms, because they are doing it alone. And a lot of the family members don't know when nor what they're using. Now, the kits that we use, the Narcan, which is a spray, and we also use the naloxone, which is a syringe, will used to combat and prevent these overdoses that's running rampant in our community. And I'd like to thank State Rep LaShawn Ford for his efforts and the initiative to start up this program to combat the overdose death, especially in the West Side community. Now, basically, we target the West Side, North Lawndale, East West Garfield, and Austin. That's our targeted area. And believe you me, it's really needed. And day after day, I'm beginning to see more and more people that are affected by this overdose epidemic, by the heroin and other drugs, the opioids, that's affecting them and their family. And again, I'd like to see more, and would like to see this continue for at least a couple of more years. It normally takes 3 to 5 years to have the kind of impact you would like to have on an urgent a problem that's existing in the community. Because the first year you're basically finding out, you're kind of doing an assessment and hopefully getting the naloxone and Narcan out that will reverse these overdoses or prevent these overdoses. But then the second and third and fifth year you can begin to get the data to show reductions or show other necessary needs that might come out of the first, second year of actually implementing this type project. Thank you.
Hi, my name is Sandra Harrison, and I serve as CEO for DBA Leadership and Development Training Consultants. DBA is a very unique training company in the sense that we work with customers wherever they are, and we have been blessed to work with the task force. As you know, we're facing unprecedented numbers of young people dying due to drug overdose, and part of that solution is educating folks both on how to administer Narcan and even understand what Narcan is. And as a professional development training company, we understand that it's more than the technical training that's required here. We also understand that a lot of soft skills are required to make sure that people on the street are empathetic to those who are suffering, and that young people understand the risk and know exactly where to find help in their community. DDA, Leadership and Development Training Consultants, is 10 years old, and we are committed to one thing: educating and motivating communities, especially communities of color, to do what's right. And what's right now is teaching our residents how to save lives, and we're doing that by educating them on how to use Narcan. So for more information, please check us out at our website. We're at www.dvatraining.org. Again, my name is Sandra Harrison. I serve as the CEO, and my husband of 30 years serves as the Chief Operating Officer. Again, we're at www.dvatraining.org. Thank you.
Hello, my name is Rodney C. Walker, and I am the Director of Youth and Family Services for TASK. And I'm here today to talk about the Westside Heroin Opioid Taskforce. Here at TASK, we run several programs that help individuals who are in need of substance disorder recovery. So one of those ways we engage our population on the west side of the city in Chicago is by training our staff in Narcan, and also in doing community outreach and assessments. So one of the great things about TASK is that we provide services to youth and families. So we have one program called the Family Recovery and Reunification Program that seeks to work with individuals in the child welfare system. Also, we have a program called the Intensive Placement Stabilization Program, where we also work with families in the child welfare system. But we do so much more. We have a program where we are working with youth in the juvenile justice system, in the Even Reporting Center, and in juvenile court. So we seek to provide assessments, case management, community engagement, placement into care, and then ongoing monitoring and support groups for our youth and our families in the city of Chicago. And our phone number, we can conveniently be reached at 312-787-0208. Once again, that's 312-787-0208. And we're conveniently located on the west side of Chicago at 2320 West Roosevelt Road. That's Chicago, Illinois, zip code 60608. So know that we're here for you and your family. Open 8:30 a.m. in the morning to 5 p.m. Monday through Friday. You can also look at our website. You can reach us at www.tasc.org. Know that we are here for you when you need help.
My name is Sandra Harrison, and I serve as Chief Training Officer for Leaders in Transformational Education, a mouthful. We like to be called LIGHT. LIGHT serves to work with young people who are 16 to 24 who've dropped out of school and are disconnected from work. Our goal is simple: get those young people back on track to both higher educational opportunities and higher earning potential. However, our young people today, especially in that range of 16 to 24, known as opportunity youth, are struggling with so much more. They're struggling with more than being disconnected from school and being disconnected from work. They're also struggling with addiction. And so as Chief Training Officer for LIGHT, one of the things that I do is work with companies like the task force to make sure that our communities are educated and that our kids and our families and our parents have the information that they need to be able to grow and learn and help solve this problem. LIGHT is committed to building capacity in smaller organizations. We are committed to helping build stronger and more productive communities. We are here to make sure that the residents of the Austin community are here to thrive. My name is Sandra Harrison. I serve as Chief Training Officer. Our CEO is Dr. Candace Thayer, and our board director is Dr. Janice Jackson from Lindop School District 89. Please reach us at www.lightleaders.org. Thank you.